Hello, everyone. My name is David Prologo, and I have the absolute honor of welcoming you to the SIR Expert Insights series on Advanced Interventional Pain Management. This is the most spectacular educational project that I have ever been a part of, and it answers the years-long question, where can we go to get trained in these procedures? It's clear that during the last 10 years, the demand for these procedures has expanded exponentially. At the same time, the evolution, innovation, and expansion of the procedures available has exponentially increased. And the time is now for us to be able to finally give you a comprehensive online self-paced course, at the end of which you will not only have your CME, but you will have digital certification from the SIR, a digital badge that you can use on your social media sites, that you can use to build business, that you can use to demonstrate to referrers that you have been formally trained in these procedures. Personally, the performance of these procedures and the application of advanced imaging guidance to target pain generators for patients has resulted in countless opportunities to help human beings who truly had no other option. So we're very excited, and I'm very excited to be able to finally offer this amazing combination of educational conduits that culminate in a comprehensive course in advanced interventional pain management. For example, of course, there will be audio lectures. There will also be interviews with experts, case-based learning modules, dynamic case-based learning modules. If this, then that. If this, should we do this? Should we do that? Detailed technique descriptions, practical tips for success, realistic tips around reimbursement and how to, quote unquote, keep the lights on while we're helping these patients. Access to an exclusive community that will not only allow for interaction between experts, international experts, and learners, but also access to interesting supplements, such as an interview we recently did with an offshore company offering percutaneous biological therapies as part of the biological week. And that, I think, is a good segue into what are the topics. I've notes here so I don't forget, because it's become such a broad and expansive topic that we wanted to make sure we touched on everything from beginner, from stem to stern, from things that only we do to those things in the Venn diagram that sort of overlap with other specialties as well. So we'll start with John Smirniotopoulos and Charles Gilliland, and we will talk about non-neoplastic spine interventions. All of the bread and butter cases, from synovial cyst rupture to transforaminal epidural injections to SI interventions and patient selection therein. I think it's important that we know this part of it as well, so that we never respond to refers, but we only do this and we only do that. We want to be able to offer everything. And then spine ablations, another subset that has evolved. It was radiofrequency ablation and cementoplasty for painful osseous metastatic disease. Now it's basivertebral nerve ablation, it's medial branch ablation, and so on. Non-spine tumor ablation, basically where it all started. We'll give a little bit of history, and then we'll bring everyone up to speed on how to select for patients, how to bill for these procedures, and technically how we can best help patients. And then nerve interventions, a topic near and dear to my heart, from cryoneurolysis to the newly evolved radiofrequency ablation for non-neoplastic conditions like shoulder pain, shoulder arthritis, knee arthritis, hip arthritis, millions and millions of patients who need help. And then spine implantables. As advanced interventional pain management operators, this represents the next frontier. Intrathecal pain pumps, spinal cord stimulators. Patients are living their lives who could benefit from these and don't have access to operators who can perform them. Biologics, which I mentioned, and embolotherapy in week 6. The percutaneous application of stem cells, of PRP. What is the mechanism of action? Who gets which one? Et cetera, et cetera. And how can we use advanced imaging guidance to more precisely deliver the right agent? Embolotherapy, genicular artery embolization, embolization for frozen shoulder, et cetera, et cetera. And we have world experts. We have Ahmed, who's our faculty coordinator for this week around, and Jan Applebaum as well, around embolizations. The spine implantables, Drs. Lochenko, Dana Dunleavy, absolute international trailblazers with regard to training and teaching and taking care of patients. Nerve ablations, we have Felix Gonzalez, who has recorded live cases for us to show us exactly where the dangers are, where the targets are, how to perform these procedures, how to select for these patients, how to follow them, and how to build your business. Which leads me to the last module, module 7, which is practice building. We talk about how to start from scratch without giving away the lecture, how to begin with inpatients, because oftentimes we're hospital-based, all the way through how and where we can reimburse for the innovative procedures, as well as the bread and butter procedures, and so on. And so the combination of all of these different types of platforms, different types of information delivery, combined with all of these international experts who have the real world experience and can share with you where there might be pitfalls, where there might be pearls. And all of this at a self-paced course with a tangible digital certificate at the end so that you can go on and build your practice and help so many people. The last piece is the special skills training at the SIR Edge fall meeting. It's not necessary to attend that to obtain your digital certification, but it will be a great complement with hands-on experience and industry and experts in person in Denver, Colorado, to cap off your experience for the pain management course. So I can't say how excited I am. I don't have words. This is an amazing opportunity for all of us, as well as the patients. And I thank you for your interest, and I look forward to talking with you again.